So for this case study, it is a 26-year-old female G0. She calls the office with complaint of lower abdominal pressure and urinary frequency. She has been in the office 4 times over this past year for dysuria and has been treated for a UTI. She is sexually active and is on April for contraception. She has a negative GYN history and she feels her UTI symptoms seem to be occurring within 12 hours of intercourse. So for subjective information, I would ask any pain, pressure, burning when you pee, and where, like in the urethra, is it vaginal, how often are you peeing, and the amount of each. Do you feel like you're fully emptying when you pee? Is there urgency? What color is your pee? Is there any blood? Any fever, pain, or tenderness on your side or flank area, to be specific? Are you sexually active? What forms of protection do you use? Any use of spermicide? When you were treated for the past UTI, what did they prescribe? For the focus exam, I would include a CVA test. I would check the abdomen and the pelvic area. For the patient workup, I would like a urine analysis, specific gravity, pH, protein, sugar. I would also like a urine culture and a CBC. So the patient's workup came back and her urine was orange. Her clarity was turbid. Her protein was 100 milligrams over deciliter. Blood in the urine, large, nitrate positive, and leukocytes large. She had a white blood cell count of 818, red blood cell count of over 900, and many bacteria in the urine. For antibiotics, she is sensitive to ampicillin, Cerbactrum, cephalosporin, Cipro, gentamicin, nitrofurantoin, and a bunch of other antibiotics that were listed. I would have diagnosed her with recurrent cystitis. So the plan for that is, for diagnostic tests, I would do a cystoscope to rule out bladder stone, lesions, polyps, and pathology. I would also like a CT, urogram, and renal ultrasound. For pharmacological and non-pharmacological treatments, I would do nitrofurantoin, 100 milligrams PO daily for 7 days. I would recommend hydration, water, cranberry juice, 2 to 3 liters a day. I would encourage vitamin C and probiotics, but not necessary for non-pharm. For education, I would explain to her how women are more prone to UTIs because the urethra is shorter and the opening is near the vagina and anus, so more prone to bacteria and contamination. I would go over hygiene, that you wipe front to back. Hydration, again, is 2 to 3 liters a day. I would encourage regular voiding every 4 to 6 hours and to void after sex. And I would advise her to use backup methods because antibiotics decrease the effectiveness of birth control, and to avoid spermicide products. Referral, I would send her to a urologist or a nephrologist just in case if it was something else, and I would recommend a follow-up in 2 weeks after completing her antibiotic therapy. Thank you.